All right, welcome to the Explainer. Today we're tackling a really serious medical emergency, one that can be hiding right in front of you. We're talking about myxedema coma. And let me tell you, this is so much more than just a sluggish thyroid. It's a full-blown crisis where every single second matters.
So let's just jump right into a scenario. Picture this. You've got an 85-year-old woman. Her family says she's confused and just super lethargic. Her skin feels cold, and not just cold, but kind of puffy, almost doughy. This isn't just someone having an off day. No way. This is a massive red flag screaming that something is going terribly wrong with her entire system.
Okay, so you see this patient. What's going through your head? Your differential is probably broad, right? You're thinking sepsis, maybe a stroke, could it be an overdose? All good thoughts. But that combination of being that cold, the confusion, and that classic puffy look, well, that should make a little alarm bell go off for something much more specific. Something that's really, really easy to miss if you're not actively looking for it.
All right, so here's our game plan. We're going to break down what this thing actually is. Then we'll look at how it happens. We'll cover the clinical signs to watch for, how to diagnose it, and the crucial treatment steps. And finally, we'll talk about prognosis and prevention. Let's get into it.
Okay, first up, Section 1, a life-threatening chill. Let's define what we're actually talking about here with Myxedema Coma.
Look, this is not just bad hypothyroidism. The key word here is decompensated. That means the body has just given up. Its coping mechanisms have completely failed. What you're seeing is a total metabolic collapse. It's like the body's main power grid has gone offline and all essential functions are just grinding to a halt. I love this furnace analogy because it really nails it. Think about it. With standard hypothyroidism, your body's furnace is just turned way down. You're cold, you're sluggish, but it's still running. But myxedema coma, that's when something else comes along. A big stressor like pneumonia or even just severe cold exposure. And it's like a sudden blizzard that completely snuffs out the pilot light. The flame is gone. And what's left is this catastrophic body-wide power outage. So that brings us to Section 2, deconstructing the crisis. The big question is, how does a chronic condition, something people live with for years, suddenly spiral into this life-threatening emergency? Well, it all comes down to a fragile balance getting completely shattered. It's really a four-step cascade. So first, you got someone with chronic hypothyroidism. Their body is just barely keeping things together. Maintaining this fragile balance. It's adapting, maybe by constricting blood vessels to save heat. They're living on the edge. Then, step 2. Some kind of stressor hits, an infection, a heart attack, whatever. That's the push. And that leads to step 3. Homeostasis fails. The body's last-ditch efforts just get overwhelmed. And finally, step 4. You get a total systemic shutdown, multi-organ dysfunction. And that, right there, is myxedema coma. And just look at this list of what can trigger it. It's kind of crazy, right? It's not just one big, obvious thing. Sure, you've got the major players like infections and heart attacks, but look closer. Sedatives, opioids, even just stopping your thyroid meds. Seriously, anything that gives that already stressed system a hard enough shove can be the final straw that breaks the camel's back. Okay, Section 3. Let's talk about what this looks like at the bedside. How does this internal shutdown actually present itself? Because the signs really aren't that subtle if you know what you're looking for. So, you're looking for that classic triad, really. 1, altered mental status, anything from confusion to full coma. 2, profound hypothermia, really cold. And 3, that generalized non-pinning edema, that puffiness. But here's the trap, the thing that can really trip you up. The signs of the precipitating illness might be completely masked, so the patient could have raging sepsis, but no fever. Why? Because their body is so shut down it can't even launch a fever response. That's a huge clinical pearl right there. And this comparison just lays it all out. Look at the difference. Hypothyroidism? Yeah, you're tired, cold intolerant, bradycardic. Manageable stuff. Myxedema coma? We're talking coma. We're talking hypothermia so severe that warming blankets won't touch it. We're talking hypoventilation, hypotension, full-on shock. It is the absolute most extreme, life-threatening end of the spectrum. All right, Section 4. You've got a high index of suspicion. The clock is ticking loud. How do you nail down the diagnosis when time is absolutely everything? Okay, this is probably the most important slide in the whole deck. I want you to burn this into your brain. You treat based on suspicion. Do not wait for labs to come back. I'll say it again. Do not wait for the labs. If your clinical gestalt is screaming myxedema coma, you start treatment. Waiting for that TSH to come back could literally cost the patient their life. It is a clinical diagnosis first and foremost.
Now, while you're getting treatment started, of course you're going to send off a bunch of labs. You're expecting to see a super high TSH and a free T4 that's in the basement. You'll also see other signs of that metabolic shutdown, like hyponatremia and hypoglycemia. But look at that last one, a cortisol level. This is absolutely critical. You have to check for concurrent adrenal insufficiency, and we're about to see why. To help formalize this a bit, there's even a diagnostic scoring system, and you can see how it works. It gives the most points to the really scary stuff, the coma, the extreme cold, the super low heart rate. If you tally up a score of 60 or more, yeah, you can be pretty darn sure what you're dealing with, and it reinforces that you need to act immediately.
Okay, on to the main event. Section 5, the treatment protocol. This is the battle plan, and I need to be crystal clear. This is a stepwise approach, and the order of these steps is absolutely non-negotiable. You have to do it right.
So here it is, the 4-step playbook. Step 1, they need to go straight to the ICU. No question. They need constant monitoring. Step 2 is all about supportive care. That means mechanical ventilation if their breathing is failing, and, this is important, passive warming. Just blankets. No aggressive warming blankets, because that can cause vasodilation and make their shock worse. Okay, but now for the really, really critical part, steps 3 and 4. The order here is everything.
And here's the absolute golden rule of myxedema coma treatment. Steroids first. Why? You have to ask why. It's because some of these patients have coexisting adrenal insufficiency, which has been masked by their low metabolic state. If you give them thyroid hormone, you're going to rev up their metabolism, which will chew through what little cortisol they have left, and that will plunge them into a fatal adrenal crisis. It's a catastrophic mistake. So you always, always give hydrocortisone before the thyroid hormone.
All right, once those steroids are safely on board, now we can relight the furnace. You give a big IV loading dose of levothyroxine, somewhere in the 200 to 400 microgram range. The goal is to rapidly flood the system with thyroid hormone and basically jumpstart that stalled metabolism.
Okay, so let's move on to our final section, prognosis and prevention. We've started treatment, but what are the odds? What does the future look like? And maybe most importantly, how do we stop this from happening in the first place?
And this is the sobering reality. Even with everything we can do in a modern ICU, the prognosis is just grim. We're looking at a mortality rate as high as 40%. Let that sink in. Out of 10 patients, 4 might not make it. These aren't just numbers on a chart. That's a powerful reminder of just how lethal this is. So what's the real takeaway here? It's that an ounce of prevention is worth a pound of cure. Actually, in this case, it's worth a life. It all comes down to prevention. That means making sure our patients understand why they have to take their thyroid medication. And for us, as clinicians, it means being hypervigilant. If you have a patient with hypothyroidism who gets sick, you treat it aggressively, because what seems like a simple infection could be the very thing that pushes them over the edge. So I'll just leave you with this thought. My myxedema coma is a great pretender. It loves to disguise itself as other things we see all the time in older patients. So the next time you have a patient in front of you who's confused, cold, and puffy, are you going to think of it? Are you going to connect those dots in time? Because for this one, your awareness, your suspicion, that can literally be the difference between a patient living and a patient dying.